Hello everybody, my name is Dr. Rajiv and I am an A&E registrar in one of the NHS hospitals in UK. I recently cleared my Plab exam and I received several questions regarding Plab exam and regarding work in UK, and I'm here today to talk to you about Plab exam and every other question that many of the people have asked me regarding the exam. So it's basically an orientation to Plab. Let's start up by talking about. Many people ask me this first question: Can I be trained in United Kingdom? Well, yes, you can be trained in United Kingdom. Basically, first, when you finish your graduation, that is, when you finish your MBBS, you do a internship. So in India, we call it internship. In many other countries, also it's called internship. Whereas in UK, it is called FY1. That's the internship. So if you have cleared your graduation, if you've done your graduation from India, for example, and you finished your internship there, you need to do your Ielts exam first, because Ielts is one of the basic things requirements for Plab exam. You need to get a good score of at least 7.5. It is essential that you get a 7.5 so that you can take the Plab exam. Some questions regarding IELTS that people have asked me is: how much does the IELTS cost? How much time do I require to study for the IELTS? Do I require any training for IELTS? I would say yes, training is essential for IELTS, even though I've known many people who are really good at English and studied in a convent school, and they still did not clear the IELTS exam. So they have taken. I know people who have taken exams for 5-6 times, and each exam costs you 10,000 rupees. So I would suggest you do take a training course for the IELTS exam for at least a month, so that you are well trained for the exam. And you need to practice a lot of question papers, do a lot of writing work, so that you are well versed with the exam pattern, the listening, reading, listening, writing, and the speaking parts of it. So once you cleared your IELTS exam, you are eligible to book for the Plab 1 exam. So the other question which I remember people asking me is: how do I book for the IELTS exam? If you can just go online and look, just type IELTS on Google, and you get all the information required for it, and you can book it online as well as at certain designated points which will be available on the website, and you can go ahead and book your exam there. Now regarding so after the IELTS, the next step is giving Plab 1 and then Plab 2. So now the other question which many people ask is Plab only the route to get into UK? Well, that's not the only route. Well, the first route is give your IELTS, give Plab 1, Plab 2, and you can work in UK. The next one is you clear your IELTS, do membership exams. That is either if you have cleared your MRCP, MRCS, MRCOG, MRC Psych, and MRC GP. If you've cleared any of these exams, you're still eligible to work in UK, because you do get a GMC registration right after you clear the membership exams. And if you have not cleared the membership exams, the easiest way to come to UK would be by clearing the Plab exam. So Plab is the easiest route. The passing rate of the membership exams are pretty low, and chances of passing will increase if one works in the UK hospitals. So if you have cleared your Plab exam, you start working in UK, and then you take the membership exams, things are a bit more easier, because once you're into the system, you know how the system works, you know what exactly other questions are going to be, because they are all practical based questions, unlike in India, where they ask you questions which are, I feel, as a personal opinion, are not really necessary. They are not practical oriented questions. They are all theoretical, which are absolutely of no use in real practice. So once you have cleared your Plab 1 and Plab 2, you get a GMC registration, which is mandatory to work as a doctor in UK. And then you can start. So, but I advise everyone, if you have not cleared the membership exams, to take the Plab exam and start working in UK. That's the easiest route rather than the memberships. Going forward, how many years does it take to become a specialist in UK? This is the next question that most of the people ask. So medical school is, depending on every country, it is in India it is 4.5 years and 1 year of internship, and now there are new rules which are coming up where you need to work in the rurals, which I'm not really sure what's happening there, but usually it is 5 years, 5.5 years of study and internship. So internship in UK is known as FY1, and then you have the foundation year 2, and then you have core training. That is, you work in a specialty for 2 years and different sections of that specialty, and then you go into the specialty training. That would be this particular. If let's say you want to take up medicine, so you work for 2 years in every department of medicine, maybe gastro, neuro, and every other department, respiratory, for example. You work in each of these for two years. I mean, not each of this. You work in for 6 months in the 4 departments. That is total of 2 years of core training, and then you have specialty training. So once you finish your core training in medicine, you pick up one of the specialty, let's say gastroenterology, and then the training occurs for next 3 to 5 years depending on the specialty you choose. So the whole training process is approximately the 2 years of core training and then 3 or 5 years of specialty training. So to become a specialist, it at least takes 7 years on a whole. For foreign graduates, specialty, surgical specialty is very competitive, difficult to get, but I wouldn't say impossible. One can enter into a non-training post once you clear a Plab exam, and it's very, unless you have citizenship in the UK, it is difficult to get into a training post directly, but if you do not get a training post, you can still get into a non-training post and start working in UK and get more experience here. And the process of becoming a consultant in UK is quite lengthy. It takes 10 to 12 years at times, but the training is very standard and it's really high. You're highly respected in every other country that you might go, in corporate hospitals in India and probably anywhere abroad. If you're a UK qualified doctor, you are highly respected and you are at high standards. Now, other question is, what is the difference between a training and a non-training job? There's a very big difference, but not a very big difference also. So the main difference in non-training is you do not have a clinical lead. You do not get a CCT, that is a completion of training certificate. So that's the only difference. Otherwise, the structures, the training patterns are all the same. You can still be trained and get a membership exam by doing a non-training post. But the only difference, you don't get a complete CCT, that's a completion of training certificate. Now, apart from this, there is a very little difference in the work training experience you get. You can write the membership exams, do the fellowship exams, and probably in 10-15 years you might still be a consultant even if you do not get a CCT. But yes, that's the most of the big difference. And many overseas medical councils recognize the membership of the Royal College as equivalent to a postgraduate exam, a postgraduate degree, So it is good. It is possible to come back to training post after working in a non-training post for a couple of years or even 3 to 4 years. You can still get into a training post. So the only thing, you need to be updated. You need to update yourself in every terms. Maybe exams, maybe small certificate courses, and regular audits, and probably if you can do some publications. And yeah, these are things that will build up your CV and you can still get into a training post. Now, let's start with something more basic. What is Plab? The full form of Plab is Professional Linguistic Assessment Board. So it's basically a licensing exam to start working in UK. Then now we're going step by step, okay? So I'll talk something more about Ielts now. So what does Ielts have? It mainly has the reading, the writing, the listening, and the speaking components. So the reading the reading part of it it has 3 passages which will be given to you, and there'll be 40 questions which has to be answered in 60 minutes. So you go have a smaller passage in the beginning, a easy one. The second one is mildly difficult. The third one is a little bit more difficult, and there are certain questions after every of these passages, and which you need to answer in the 60 minutes. Then you have the listening part. The listening part is where you'll be given headphones, and you put the headphones on, and you have a proforma which is given to you with fill in the blank kind of pattern, and as you're listening you need to fill in the blanks with the relevant thing that is required to be filled in the blank. That's a pretty easy part unless you have difficulty in interpreting the English language and the accent. And then comes the speaking part. The speaking part is quite simple. If you know good English, if you can converse well, you have good communication skills, I think you have no problem at all. You can easily clear the speaking part. There is a one-on-one session where you'll be given 5 minutes to speak, and you're given a topic which you need to speak for about 2 minutes, and there'll be some random questions which the examiner will ask you. It's a very short duration, 5 minutes. You don't even realize when it's already done. And then comes the writing part. Writing part has 2 essays which need to be written, and 1 reporting kind of paragraph where you'll be given graphs or charts, pie charts, where you need to interpret them and make an explanation about that for at least a page, I suppose. So that's about IELTS. And GMC, all this information is given up on the GMC website, and the score that is required, the updated current scores are all put up on the GMC website, and you can go through them. And I basically, talking about my experience, what I did for the IELTS is I went to a very nice English professor in Bangalore. That's where I did my graduation from, and I worked there for a while. And so this particular gentleman, an elderly gentleman, was really good at his English and gave me the essential training required for IELTS, and I did practice for 1 month. English writing. I was working, let me remind you that I was working, and I was taking these classes 3 times a week, 3 hours of class 3 times a week, and I used to take back home quite a lot of homework. I used to practice 3 graphs a day, and I used to write essays at least 3 to 4 essays a week. So a proper 1.5 month of training, I would say, and I did put in a lot of effort and time. I downloaded a lot of material from online which really helps you in clearing the IELTS. So now coming down to, let's say you clear your IELTS and you have booked your Plab 1 exam, and the Plab 1 exam, another question some people ask me is, how much does the Plab 1 cost? In Indian rupees, I think if I remember right, it was close to 15 to 20,000 rupees, the first step. And I got a center in Bangalore, and the pattern of exam is you had 200 multiple choice questions, and questions will be from medicine, surgery, obstetrics, pediatrics, and orthopedics, and very few questions from basic science, that is anatomy, biochemistry, pathology, microbiology. Personally, what I did for preparation for Plab is they usually say 6 months of preparation which is required for Plab exam, but I took 4 months. I did a lot of study during the 4 months. The initial first 2 months I was working and studying at the same time. The next 2 months I gave complete time for Plab exam. I used to study approximately 10 to 12 hours a day for the last 2 months where I was preparing for the exam. And I saw a lot of question papers which is available online. There is a lot of forums, like there's on Facebook there are forums, and if you just type on Google question papers for Plab 1 exam, and you will get a lot of options where you can solve papers online. Well, you do have to pay a minimum amount for these exams, like For example, I'm not promoting any of these, but these are the things which I have used. There's oneexamination.com, and then there is mcqbank.co.uk, and then there is Samson's, then Plab, these Swamis, all these have they have uploaded a lot of question papers, and a lot of these questions are many times repeated, and it would be very essential if you solve at least, I would say, 4,000 to 5,000 questions, and that would really increase the chances of you passing the exam. It is very essential that you read these two books, that is OHCM and OHCS, that's the Oxford Handbook of Clinical Medicine and Oxford Handbook of Clinical Specialities. The important topics, the areas from where the questions are frequently asked are, it's all the practical parts of the of medicine that where the questions arrive from, and you will realize that only after you solve all the question papers. So it's very essential that you read the question papers and go back and read the theory part of it, so that makes things more easier for you. I would like to share a few scores that I got when I was solving the exams. These practice tests was, I got 126, 155, 138 at times, and I used to get 160, and slowly as and when I solved the question papers, my scores got better. At one point I even scored 190 because I solved so many questions, and just even before I finished reading the question I knew what the answer was, so I didn't really have to look for it. So you have 5 options, and there's only one right answer out there, and the other 4 options are very much close to the correct answer. So it is a dodgy exam, but if you have practiced a lot, it's not difficult at all. My actual Plab 1 exam scores were 152 if I'm not wrong, so I did score quite good, and the minimum requirement is at least 75%. So you don't have an exact number of questions that you need to pass. It's like a percentile based, so it depends on how much everyone scores, and they set in particular number of questions that you need to clear. So when I gave the exams, it was 125, and I scored pretty well, and I passed the exams. Next is, so once you cleared your Plab 1, you can go ahead and look for your Plab 2 exams. So now I'm just going to go a step back, and I will explain about Plab 1. Plab 1 exam takes place in India in November, as well as in it's in March and in November. These are the only times you can take it in India. If you want to take it any time in between that, you need to probably come to UK and give the exam. So make sure you plan well so that you can exactly finish your syllabus by that time and give the exams. Now, let's say you've cleared your Plab 1 exam, you book online again for the Plab 2 exam. So once you booked so Plab 2 exam, I think it costs something close to 30,000 if I'm not wrong. You can get the exact figures on the GMC website. So now about Plab 2. Plab 2, it's a clinical exam which tests your history taking, examination and counseling skills mainly. So you have mainly 17 stations that you need to clear. You have 2 pilot stations. Pilot stations are the ones which they're experimenting. They're experimenting these questions and their responses by the students. So these are mainly test questions. The 14 exam stations mainly. So 17 stations out of the 2 are pilot. 14 stations are the real ones, and there's 1 station out of the 14 which is a rest station. So each of these stations are 5 minutes, and you get 5 minutes to do a particular task. So let's say, for example, you have an suturing that you need to do. So you get 5 minutes to do a good suture, and as per the procedure, let's say you get in, for example, an acutely asthmatic patient where you get a mannequin. It's called the SimMan, which actually gives you readings very similar and voice responses like a patient. So you need to assess the patient, give you diagnosis, give you appropriate treatment, and explain your diagnosis to the examiner in the 5 minutes. Some other formats of questions that might come up is take history and discuss the differential diagnosis with the examiner, take history and discuss the management of the patient, examine the patient, discuss the findings with the examiner. Manifestations mainly are you do have to perform a rectal examination, a vaginal examination, IV cannulation, suturing, and then there is SIMMANs, as I told you. SIMMANs are the ones which mimic an actual human response. And now, yes, now I just got some information regarding the fees of each of these exams. So these are not up to the mark, but this is somewhere close to what it could be. So Ielts right now could be costing you close to 10,000. Plab 1 is 14,000. Plab 2 is 44,000. Plab 2 coaching can be close to 40,000. The visa fees is around 10,000. Airfare around 80,000. Accommodation depends upon what accommodation you choose. And some of the coaching centers do offer a sponsorship program where you don't have to pay initially, but once you clear the exam and get a job, you pay them afterwards. So some of the coaching centers that I know of, and I am in quotes not advertising for them. So as far as I see, so once you finish your Plab 2 exam and you clear your Plab 2 exam, within a month you receive your results, and if you cleared it, you can apply for the GMC registration. So once you have the GMC registration, you have the right to apply for jobs, training or non-training, and if you get the job, you take it, and depending on the specialty you like. And as I told you before, you can follow that route. Some other questions people ask me is about the visa. So visa depends upon every country, but if it's of India, I can give you a little bit of help. Visa process for the first step, for the second step, if you want to come to UK, you can show your Plab 1 exam results as well as your Plab 2 booking, which can itself help you get a Plab visit visa, which is for 6 months. And once you've done that, if you clear your Plab 2 exam, you get a job here, you can apply for a Tier 2 visa, which is quite easy. And if you want me to make an video regarding just visa, do let me know and I can make something of it. So some other things people ask me is, how do I improve my CV so that I can get a good job? So to make sure that you get a good job, you need to have a good CV, and the CV is built up by making sure that you are up to date with your education, you have no gaps between your education, you have been doing audits, publications, and any extracurricular activities that might involve teaching and anything related to medical education. So these are all important, and if you worked in any particular specialty for a period of time and you gain experience, do put that down on your CV, and that will be really helpful. And make sure you do get some certificates which can show that you actually worked there. So recommendation letters are absolutely essential. So next, so if you clear your Plab 2 exam, you got the interview, so what are the questions they might ask in the interview? Questions they might ask you is, tell me about yourself, and so you answer in about 3 to 4 minutes about what exactly you think about yourself. Question in 3 to 4 minutes. They might ask you what is an audit, what is clinical governance, what are the pillars of clinical governance. They might ask you clinical scenarios from Oxford Handbook of Emergency Medicine, and you need to answer these questions. And sometimes they might give you ethical questions, which are quite important, where you have a drunk colleague or a consultant who is not behaving appropriately with patients or the staff. So these are these are the kind of questions they might ask you. They might also ask you about what will you do for us, or they might ask you what do you see, where do you see yourself in the next 5 to 10 years, and tell me about your weakness and tell me about your strengths, and tell me about your experience in medicine and some of the interesting cases that you might have seen. So these are the kind of questions that come up on an interview. So make sure you prepare well for these questions, and you make sure that you're able to answer these well. Well, these are the things that I thought were important that most of the people had asked me. So if you have any further questions, put it down on the comment bar, and I'll try and make a video collectively of all the answers which I can. And thank you very much for listening, and best of luck for your exams. Take care. Bye bye.